Hello, good afternoon. So we are group number 3 and we had given a project on vital signs, and now we have created laryngoscope. This is a laryngoscope. What is laryngoscope? Laryngoscope is an essential medical device used to visualize vocal cords, larynx, pharynx, trachea, etc. And it is commonly used by the anesthesiologist and emergency medical professionals. Indications of the laryngoscope are: it is used in endotracheal intubation, orotracheal intubation, nasotracheal intubation, and tracheostomy. Scope with the dominant hand, whichever way you are comfortable. Usually it is hold on the left hand, but I'm comfortable with the right hand, so I'm going to hold it on the right hand. So it is inserted in your mouth from here, like this, and the light is there, which is switched on. Like this, it is inserted.
The continuous process of intubation, just like my sister and Asta. So when we open the mouth, we're looking out for trachea. Trachea, we know trachea when we see white sponge in cartilage. Because when we open, you can see two holes. One is esophagus, and second is a trachea. It's up. Trachea is also up, and esophagus is down. So we put ET tissue. When we look for vocal cords, we open epiglottis, and we can see that white punches. So there is the place where we put the ET tissue.
A laryngoscope device. Generally, it is used by anesthesiologists, as my friends said. And this device is generally used to visualize the vocal cord. It is used for incubation, and it is used when the patient cannot get breath by itself, when the patient have obstruction in their airway. So at that time, the laryngoscope is used. So these are the basic uses of a laryngoscope.
Functions and components: handle, blade, light source. Handle provide a grip from the operator and house the light source and battery component. Blade, the curved portion that elevates the epicolates and exposes the larynx. Light source provide illuminations for clear visualizations of the air.
Okay. So now we are going on to the maintenance and cleaning of the laryngoscope. So first we have to disassemble the blade and the end. And then next we have to clean these parts using disinfectants. And then the third part is drying these parts to prevent rust and damage. Then the final part we have to reassemble to make sure that everything is working well.
So here are the different size of plates of the laryngoscope, which start from 0 to 4, and from which 0 is for infants, and 1 is for young children, and 2 is for adult, and 3 is for obese patient, and 4 is for those who have difficult airway scenarios.
We go on in advancement in laryngoscope technology. In laryngoscope technology, we start in a video laryngoscope. Video laryngoscope, we have just like a screen and a laryngoscope. Also, we've improved illumination just like a light, and also from a flexibility blade and a wireless capability. That is all.
Clinical applications of laryngoscope. There are 3 clinical applications of laryngoscope. First is airway management, and second is diagnostic procedure, and third one is surgical interventions. Okay, airway management. Airway management is securing the airway for patients undergoing surgery or critical care. And second, diagnostic procedure. Visualization the larynx for identifying and assessing airway pathologies. And third one is surgical interventions, assisting in surgical procedure involving the larynx, trachea, and vocal cords.
There are 3 types of blades of laryngoscope, which are Miller blades, McIntosh, and straight blades. Miller blades includes straight blades that lift the epiglottis directly, and McIntosh blades, curved blades that lift the epiglottis indirectly. And the third one, which is straight blades used for intubation with direct visualization of the vocal cords.
Laryngoscope safety consideration. Basically, it is based upon 4 terms: sterilize and disinfection, blade selection, proper techniques, teamworks.
So this is the light source. These are the different sizes of blades. This is the laryngoscope handle with the larynx blade attached, and this is the advanced laryngoscope. Thank you.
स्टार्ट करो ठीक है स्टार्ट करो जल्दी अब हो गया
रुक जा नो इसका हो गया गलत हो गया पता है कट कर पॉज कॉन्ट्रा इंडिकेशन बोलने आओ कोई
Contraindication
Who is the contra